You look very cute. Will you take off your shirt? Show your other shirt that you wear.
Oh, we're going soon, Jesse. Let's stick it up.
So how many weeks pregnant are you?
13 weeks.
The real heart of it all is on how you bring a child into the world.
Every single mother I've ever interviewed out of hundreds of interviews who has given birth on her own, whether at home or in a birth center or in the hospital, says the same exact thing. If I can do that, I can do anything.
I love you.
I love you.
Let me ask you this. If in 1975 our C-section rate was 7% in this country, why is it 29% now?
The hospitals lose an awful lot of their babies. They lose a lot of their mothers. There's a high mortality rate.
It doesn't seem like having a baby in the hospital is the safest thing to do. And as a husband, it's my job to protect my wife.
I think the worst thing that we're doing to women is not telling them the truth.
The last person I want to trust the life of my wife and unborn baby with is frankly the medical system.
The German word for hospital is sick house. You know, we don't need these normal births in a sick house.
So we're gonna have our baby at home. We're not gonna go see a doctor. Mandy has decided not to take any kind of drugs whatsoever. And we're not gonna do any tests.
There were people born 1 million years before they had doctors. It was never required. It was a natural procedure.
I want my birth to be a magical moment. I want to create that experience for myself, for my baby, for my husband, for us as a family.
The other day when we have a baby and we're holding him or her in our hands, we'll know that we did the best that we could based on what we discovered throughout our journey.
We are pregnant in America. Where do you hope to have your babies?
You mean where city-wise or where like hospital versus house?
Oh, that's a good question.
Very good question.
What do you mean?
Kaiser Hospital.
Probably a hospital.
Definitely a hospital.
But there are some hospitals that specialize more in natural childbirth, and so that would be my preference.
I don't think a hospital is necessary. I personally don't like hospitals.
I'm a big believer in midwives and doulas and having children at home, but personally I would go to a hospital. Right now, that's my feeling. Although I've known lots of people who've had very successful home births in water, and yeah, it's a choice.
The fluorescent lights, the creepy nurse outfits, and like the sterile beds that's just like antibacterial smell, it's just kind of sickening.
Now with all these hospital problems, I think I would rather do it at home.
I've always wondered how it would be at home, like in the comfort of your home, where you know everything's at.
You know, health-wise for the baby, it seems like, you know, it's a no-brainer for the hospital.
And what made you decide on having a baby in the hospital?
Probably just the technology, the healthcare, everything like that.
Obviously, you plan for a hospital, but there's other circumstances that sometimes don't allow it.
I think that would be the safest thing to do. Like I said, I have no experience at it.
I don't know, I'm maybe a little bit scared.
Because I don't know how to have a baby on my own, you know? If I know how to do it, I would do it.
More than 4 million women give birth each year in the United States. 98% of those women choose to have their baby in a hospital.
Childbirth in America is so difficult right now.
We have, in Western civilization, thought now, because of our programming and training, that birth is a very dangerous event, and therefore you must go to the hospital.
Too often, pregnancy care is boilerplate, it's a protocol, and there's not enough room for individualization.
McDonaldization, the application of fast food principles like time, efficiency, and control to other areas of American society.
The modern hospital is increasingly a business, and they're increasingly owned by huge conglomerates which are applying these business principles to their operation.
Would you like fries with that?
Today in our country, babies' birthdays are not being determined by nature. They're being determined by doctors' schedules and hospital schedules.
It's basically the same kind of advantage that Henry Ford found over 100 years ago in the automobile assembly line.
Childbirth is a money-making machine. It's a business.
And hospitals, the majority of them in the United States, are owned by large corporate chains.
Most people know this. The woman in the family is somebody that chooses and drives the healthcare decisions in the family.
Hospitals now advertise abundantly on billboards about their maternity wards.
You begin to build this long-term relationship with the family. Their kids see the pediatricians that are next door in the MOB. The dad gets the knee replaced in the OR. It just becomes their place, and we hook them in by providing women's services in the form of OB and GYN and some other things that can be done.
I remember one woman saying to me, "You have to have your baby in a hospital because, like, my friend, they gave her this wrong medication and she almost died. And if she hadn't been in a hospital, she could have died. If she hadn't been in the hospital, they wouldn't have given her the wrong medication." But it doesn't matter. The hospital is the place where it's not your fault.
What large organizations are seeking to do is to McDonaldize hospital operations as much as they possibly can.
Well, Mandy and I decided to hit the streets of New York City to find out what the average person thought. Only when we got there, people seemed to be overly concerned about one thing.
Childbirth? Pain.
Hurts.
Pain.
Labor, the process of giving birth.
Nasty.
Lots of pain.
I just had one. You did? How was it? Woo! Painful.
I don't know, I hear it hurts.
Labor, physical or mental effort, work, especially when difficult.
I don't think it has to be horrible, but I think it's not pleasant.
Scared. They've even talked about possibly adopting rather than actually doing that, having their own, so.
Mandy and I heard that things were a little different in Uganda.
And she came and squatted over him, and very quickly, here came a baby. He said, "I either caught it or let it fall into the bottom of that hole," which they used for birth all the time. They then got him out of the hole, and everybody was congratulating him, and they were so excited that this baby had been delivered by an American baby catcher. And they were passing the baby all around for everybody to nuzzle and kiss and hug and so on. And the delighted, beaming mother there, she put that baby in a sling next to her breast, and she went back over, and she picked up that blankety-blank hoe and started working in her garden again. He said, "My world fell apart. How would I ever go back to the world of medicine as I knew it?" When now I knew what a simple and joyful and quick, apparently painless thing this was.
So what are your feelings on it? Are you nervous at all? Or are you...
No, I know with certainty that I can have a pain-free childbirth without drugs. And I've even heard that women have orgasm during childbirth.
Oh, I didn't have one with my kids. That's not fair.
I never heard that.
Like,
I
Mama had 3 at home.
The woman is giving birth well and making some of the sounds that spontaneously come out of some women. It sounds an awful lot like good sex.
Oh, dear. Sign me up.
My name is Mandy Bonagorio. I'm going to have an orgasm during birth.
What'd you say?
I don't
don't think I believe that one.
Yeah. I heard about it, but I don't know if it's true because it never happened to me.
Now, if you can really do that, hey, more power to you. I wish I could give birth and have an orgasm at the same time.
Well, actually, you do feel a little tingle. I'm not gonna lie, you do feel a little tingle. Once that baby head come out, you feel a little tingle. Getting kind of warm, you're like, oh shit.
I've never experienced that one.
When the baby's coming out, actually when it's coming out, that's the best time during the pregnancy to me. It feels very warm when it's coming out. Very warm and nice.
You can hit different angles with inside uterus.
You could feel your vagina is naturally open up, and you just felt a warm feel just sliding out.
I think it's impossible.
Impossible?
Yeah.
Why is that?
Because it's labor and it's painful.
It felt good, no pain, and I'm not lying.
When you're pregnant, you go through a lot of emotions and a lot of things go on with your body, so anything's possible.
Good luck.
Okay, maybe an orgasm is a little extreme, but does it seem to you like today men and women are more focused on the pains of giving birth rather than the joy or empowerment?
The epidural has become so pervasive in hospital birth. The conversation among women is usually, how soon are you going to get your epidural?
Epidural, an injection of drugs into the epidural space of the spine to create a loss of sensation in a woman's lower body.
Doctors don't ask the question, how can I make this easier for the mother without drugs? They never ask that question. They ask the question, why would any woman want to go through this experience without drugs?
They kept asking me if I wanted an epidural, but I didn't.
Some of us have found that the process itself, the actual process of birth, is quite an extraordinary event and would choose not to just miss that.
I just wanted to try and go natural as long as I could before taking any medicine or anything, that I didn't absolutely need.
Being able to be a strong woman but also have a feminine soft side is very difficult to do today. And to really accept and to have integrity and pride in being a woman today means so many different things.
Not to miss it by being completely numbed through it, not to miss it by being surgically removed from it.
And I kept saying, no, I can do it, I can do it.
If you have something the size of a small watermelon coming down through your body, it is going to push things out of the way.
Oh, that's going to just shred you up.
Are you positive you don't want this? And I'm like, why? Should I be getting it or something?
Any part of your body that you would try to stretch and pull, even if you put your fingers in your mouth and stretch them right now, it stings.
I ended up having my son without any pain medication.
They don't see the psychological benefits. They don't see the benefits 3 months down the road.
There is not cultural valuation anymore on women's bravery and courage in putting their babies out on their own, except in the natural childbirth and home birth movement.
Doula, a woman experienced in childbirth who supports a mother physically and emotionally before, during, and after birth.
So many women go into a hospital and say, I want to have a natural birth, and they tell the charge nurse, don't come near me with drugs. Please don't ask me if I want drugs. And the woman gets into this place of vulnerability in her birthing, and the nurse comes in and says, oh, honey, you can really make it through this if you just have a little bit of painkiller, a little bit of epidural, whatever it is they want to offer. And when a woman's vulnerable, she might say, oh, okay. And so as a doula, I would come in and say, remember you wanted to do this natural. Are you sure you still want to do this way? Just to kind of help them get their voice back.
For me, facing my fears is a part of me becoming more of the woman that I want to be.
What if we told you she's going to have her baby without any drugs? Without any drugs, no painkiller or nothing? That's awesome. Natural birth is good, man.
Easy for him to say.
Epidural, absolutely. No pain.
You just want drugs?
I want drugs.
I actually had natural childbirth. I don't recommend it for everyone. If you can get your hooks, take it. It's much easier.
I can't imagine having a child with no drugs. It really, 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 really hurts.
Did you have the epidural?
No, I didn't.
You did it natural?
Yeah, natural birth.
Why is that?
Why is that? Because I'm a strong lady.
Yeah, I'm strong.
I know another strong lady, my mother. 30 years ago, she made the commitment to give birth to me without an epidural or any other type of drug. Thanks, Mom. It really means a lot to me that my mother made that choice. Today, up to 80% of women are making a different choice. Why aren't more women making the decision to just say no?
Women now have a right to pain medication. That's the way it's presented in obstetrics, and women are buying into it.
My sister just had a baby, and she had
epidural?
Epidural. She didn't really want it, but at the last, her pain was so bad, she said, I'll take it. She hated it because the whole time she was yelling, I feel lost, I have no control.
A mother and a baby are designed to work together during labor, and when drugs are used, they both are drug impaired, so they're not working together.
And that's not all to consider. Apparently, there are a few risks associated with having an epidural. More than a few.
We know that toxic chemicals go straight through the placenta and affect the baby.
The drugs that are used in the epidural cross the placental barrier, go into the baby's body.
The experiences of the fetus and the newborn baby, whatever experiences it has, ultimately select the genetic expression that can lead to cancer.
There's studies that link birth drugs with teenage drug addiction.
Behavioral problems,
Cardiovascular disease,
attention problems,
obesity,
nightmares.
Teenage suicide.
And it was seeded when we were kids, only to manifest itself when we're adults.
Sounds scary, although studies often claim all sorts of things. But let me ask you a question. What if birth drugs do have negative consequences? Is it really worth the risk? Making a documentary on my wife's birthing experience. And you said you're an anesthesiologist? What, like, my wife doesn't want to have an epidural because of health reasons for the baby. And some things that we've read online. I know sometimes maybe it's necessary, but are there consequences? Is there any danger to the baby having...
Not having an epidural?
No, to having an epidural.
To having an epidural? Not really.
Not
any
really?
More than anything else. I mean, anything you do, there can be a danger to the baby. Anything. But there can also be a danger to not having an epidural.
Like, I've spoken to a lot of natural birth people also, and like, a lot of them say like the most empowering experience they ever had was delivering a baby without any drugs.
Yeah. Some women feel that way. Some say they'd never do it again. I mean, I know that a lot of my wife did it once without an epidural, and it's empowering. I don't know. Some women it really means something to them to do it without, do it naturally. So, cool. Sounds like your wife might be one of those.
She definitely is.
Okay.
She definitely is. She wants a natural birth. We're even thinking of having an at-home birth.
Ah, now that's dangerous.
Thanks, Doc. Why? Why?
Well, when you do this, when you see as many deliveries as I see, you see a number of them that supposedly were low risk, and then something bad happens. And if something bad happens, you don't have time to get to the hospital.
We have for 50 years been brainwashing American women about childbirth, about how dangerous it is, how all the terrible things that can go wrong, and how you need to be in the hospital where all the doctors are and all the machines are and all the operating tables so that we can take care of those horrendous emergencies when they occur.
And it's not true?
It's absolutely not true.
There have been lots of studies that actually look at whether home birth is safe or not. And what they find is that home birth actually can be safe. And in some ways, and I hate to say this because it'll make my obstetrician colleagues cringe, in some cases, home birth is safer than hospital birth if you look at the likelihood of cesarean section.
Home birth can be safer than hospital birth? This was worth looking into. So he hopped on a plane and went to Holland, the home birth capital of the world, where lots of women are choosing to have their babies at home. We met Dr. Tom Kroening, who actually lives in this windmill right here. Dr. Kroening shared his thoughts with us about how pregnant women should be treated.
But we don't see it as a medical thing. It's a natural thing, and sometimes you need medical assistance.
So that in America, it's not usual that you deliver at home? No.
Because there's less bacteria at home than in the hospital. A lot of people think it's a sterile environment in the hospital, but it's the contrary. There's a lot of bacteria in hospitals, a lot of very ill people.
I didn't see any hospital during the labor.
87% of the women we see in our practice delivers at home. That's quite a bit, eh?
Yeah. Anytime we mention it to friends or family, they say, at home? They still do that? Yes, it's natural. But you have a doctor, right?
Because we have healthy women, we have healthy pregnancies, we don't see much complications.
I'm 41. You're 41? Yes. So I'm a very late mother, but everything went well.
She delivered at home?
Yeah, at home. I lived at home. No complications. I liked it.
We go visit them also every day. After the delivery, we always do a round to check all the women and children. It's always been like this, and it's all covered. And especially the home delivery is very cheap. You don't need an expensive hospital, you don't need an expensive gynecologist, you only need a cheap midwife.
Holland was amazing, and it was incredible to see the different viewpoints they had about birth. They had completely different beliefs, completely different attitudes, and completely different practices on how to bring a child into the world.
What do you think of life in Holland, honey?
I think I could live here.
We were also invited to sit in on Dr. Kroening's office hours and get a chance to meet lots of Dutch couples and women and hear some of their ideas and attitudes about birth.
Mandy and Steve.
Hello. Hi. Nice to meet you.
Nice to meet you. It's very comfortable to be at home and to just have your own things around and be in your own bed. And
We select, we do risk selection. If there's a problem, there's a serious problem, they go to the hospital. So the ones we keep here, they are healthy women with healthy pregnancies. We don't see it as when you go with your car to the garage and you fix something. Because usually nothing is broken or nothing is damaged. We don't say patients, we say clients, because they're not ill. You coach them through pregnancy and delivery, and you have to do that really well, because they won't forget you for their lifetime.
I read somewhere that in America there's so much pain medication during the labor, and that's not usual in Holland.
They know it hurts, but it's only for a short period of time. And well, my mother did it, and my grandmother did it, so I can do it. So, and of course there are millions of other women in the world who did it.
I think that it's not necessary either, because the woman's body is built to do something like this. The feeling that you have afterwards is much better. That you can be prouder of yourself that you did it all on your own.
We traveled to Germany because we had heard that hospitals in Germany catered much more to the needs of women than hospitals in the United States. For example, in German hospitals, there are more options for women to give birth.
Some women like to be in a wide room that needs space and air and light, and then there are other women who want it nice and cozy. If you let a woman move the way she feels like it, she will find the position for herself that hurts her less and where she feels the baby moving really. There's no good reason for a woman to lay like this, because the pelvic bone here in front is hindering the baby's head, of course. The baby has to make a movement around it. So in the end there's a curve that the baby has to do, and it is delivered upwards. So the woman has to put double force. She has to push the baby out and she has to push it up. As soon as she turns, the whole second problem isn't there anymore.
And in countries outside the US, it is more common for women to have more personalized one-on-one attention when giving birth. Midwife, a person trained in natural methods to help women give birth at home, in a birth center, or in a hospital.
Part of my job to empower women that they can trust themselves, or that they learn how to trust themselves. Somehow you have to go through the birth on your own. I mean, you're the only one who's actually able to give birth. The other ones can do a vacuum or a forceps or an epidural or a cesarean section, but you as a woman, you have to give birth on your own.
Mandy found these words to be inspiring and was curious about the benefits of using a midwife. An American woman who gave birth in Germany shared with us her experience.
You know, Christina came to visit me as well in the hospital, and it was just very nice. You know, she said, oh, you know, it's kind of normal to have a midwife and insurance pays for it and everything. So it's like, okay, well, let's see. And then after the first or second visit, I was really like, oh, wow, this is great, because she's checking not only the baby, but she's checking me as well to make sure, oh, it's okay, everything looks okay, you're healing. And that was very reassuring. That's so reassuring to me. It made me feel more confident. You know, there were, you know, you're so emotional after the days afterwards. I think I burst into tears, I don't know how many times.
Hi.
Hi, Max.
But it was just support, you know. But that, I think, was the biggest difference, was after the fact. I had Christina coming to me, you know, every day for nearly 3 weeks.
Midwives are treasured in the societies they lived in.
Childbirthing's always been a woman's position with other women and a community to support themselves.
They knew things about birth, life, death, human body, emotion, mind-body connection, the healing properties of plants, of certain foods, and so on. And this is precious to many societies' survival.
Martha Ballard is an American pioneer colonial midwife who practiced in New England, who left a diary. In her case, 95% of the births she attended came out just fine, without a doctor, without any medication, without any antiseptic, you know, just common sense and helping women through the pain of labor, helping them be in physiologic positions for birth. That's basically all that most births need.
Medicine came on far later, you know, and took a lot of its knowledge from midwives and wrote it down. And the written word is a lot of what changed things and gave medicine its power.
Actually, there was a real fight between midwives and doctors.
Almost all societies had midwives, you know, and their names are even interesting. Midwife, what does it mean? With woman in English.
We now have bought a belief that midwives are tinkerers that are, you know, could interfere with everything and make it all, you know, like who would have a baby with midwife when you could have it in this bright, shiny hospital?
In Icelandic, you have ljósmóðir, that means light mother.
Within a generation, the medical world moved in and passed laws that made it even illegal to have a child at home.
In French, you have sage-femme, wise woman.
If you had your child at home and something should go wrong, you could be in prison for the rest of your life for it.
In Swedish, you have jordmor, earth mother.
And you had a real campaign that was pretty horrifying when you look at the pictures now. Very racist Irish midwives with whiskey in their bags, Jewish midwives with great big hook noses, and really racist, ugly, ugly campaign to drive the midwives out of business.
And midwifery, the helping women, were stomped out, literally.
Partera, that means she who parts, you know, the mother and the child.
Ina May Gaskin, who I know you interviewed, she's a wealth of knowledge that should be explored by conventional medicine.
Let's look at the numbers. At her midwifery center in Tennessee, Ina May's midwives have helped over 2,000 women give birth. 95% of the women in their care needed absolutely no medical intervention and never went to the hospital. Out of the more than 2,000 women, less than 30 of them had a C-section. That equals a C-section rate of less than 1.5%, versus the national average of 30%. It's exciting that these women get to experience such great results. But what about the other 4 million women who give birth each year in the United States?
Hopefully, things will change. I think there's a tremendous movement in this country to reshape and reform birth.
I deserve and want the best for me.
I agreed with Mandy, so we hired our own midwife.
So I've had my own practice for 10 years, and I've seen a lot of wonderful, what I call butter births, smooth as butter. And then I also have had some complications. When there are complications where either the mom or the baby deviates from normal, I have no problem asking for help. And because I'm licensed, I can get support in the hospital right away. And I'm not afraid to either call 911 or get in the car and go. Because the most important thing is that mom and baby are safe and healthy. And in the event that we have to go, I stay with them until everybody is stable. I've never lost a baby, never lost a mom.
Mandy wanted to let her father know she was planning on having a home birth, to see what he thought about our decision. The horse breeder and former racehorse jockey reminded us about the wisdom of Mother Nature.
Most animals instinctively, I guess, want to go off and be by themselves, you know, and they try to pick a safe place where no predators can get to them. And I've had them take them down here in the back and have them, and you can walk all around down there and you can't find them, but you know they're there. And sooner or later you'll just stumble up on them because they've got them hid so well. You just don't do a whole lot of things to a horse, you know. They pretty much have one natural. You don't have to induce labor. I mean, you get worried about them if they go over, but they'll end up having it. A lot of people sit up all night long with them. I've tried to do that and they never have it. And the first night I don't, I walk out the next morning and I got a baby.
So how would you feel about Mandy using that same kind of concept? One of the people we saw in Europe told her, she asked for advice and he said, you know, just lock yourself up in the bathroom and don't come out until you have the baby. You don't need anybody's help or anything. What would you say about that?
Well, I would like to have her leave herself an option, you know, but you can't never tell when you might decide to change your mind or would just want somebody there. As long as there's no serious problems, I don't know but one person that can have a baby, and that's the mother. Mother Nature knows best.
To make birth as beautiful and sacred as it can be, and safe, of course, very safe, we need privacy. We need to feel safe, but we can't give birth with somebody offering you massage, music, movement, telling you how to breathe. You know, it's very depowering, and we don't need it.
The basic need when women give birth, when mammals give birth, is privacy, not to feel observed.
When a woman is in labor and you disturb it because you start to give advice, support, loving hands here and there, talking to her, trying to look into her eyes, when you disturb the process, the contractions start to slow down, slow down, slow down. It comes a time where most women are completely lost.
Did you throw up?
No. I started to have the feelings of it. You know, it's so true. About the privacy thing, because as soon as I heard you turn off the car, I had a feeling you were getting the camera and my body just stopped and it wouldn't like relieve itself or move into the next period.
It's well known that to give birth, a woman, like all mammals, is supposed to release a complex flow of hormones, a cocktail of hormones, the main one being oxytocin.
oxytocin, the love hormone needed to initiate and facilitate a woman's labor.
The minutes, the seconds after giving birth is when the woman gets the highest oxytocin rush she will ever have in her life.
Oxytocin, the main one, because it's necessary to contract the uterus.
The more you're relaxed and happy, the more your oxytocin levels are high, the easier it is and less pain.
There is immediately after the birth of the baby a short period of time which will never happen again and which is critical in the mother-baby attachment.
That's called the birth high. It's so that you go into ecstasy right after you give birth to receive your newborn baby, to fall in love with your newborn baby. Your whole body responds to the presence of this baby on your body. The milk starts to come. The baby responds with its own pheromones and its own flood of hormones and begins to suckle. A successful bonding and breastfeeding are established, and so is a lifelong beneficial relationship.
In our society, many women are not in the right environment to reach the right hormonal balance. They cannot release their oxytocin, they cannot release also their endorphins.
Once we introduce fear into the birthing process, then oxytocin is inhibited and adrenaline dominates.
That's why most women at the present time in our society needs pharmacological substitutes, drugs, to replace the hormones they cannot release by themselves. And of course, what they need first is a drip of synthetic oxytocin. The most common trademark in the USA is Pitocin. It's synthetic oxytocin.
Induction, the use of synthetic hormones, i.e. drugs, to artificially initiate and facilitate labor.
The pharmacological induction of labor is one of the most serious, drastic, and dangerous interventions that you can make, and should only be done if there's an important medical risk here.
It's a good idea if you want to control your staffing requirements. It's a good idea if you want to talk about liability.
And the feedback that you get from the multitudes of small, medium, and large programs, there's just a move for more inductions.
It's a great idea if you own a drug company.
Between 1990 and the year 2000, the induction rate doubled from 10% to 20%. During the same 10 years, the number of babies born Monday through Friday shot way up.
Doctors, by this time in American obstetrical history, are so used to using Pitocin for induction or augmentation that they literally don't know how to attend vaginal births without it.
Why are we not looking further than the end of the intravenous tube that these women are subjecting themselves to?
It's the C word, convenience.
There are medical reasons, like if the placenta is coming off the wall of the uterus. Absolutely. Medical problems with the mom or the baby? Yes, obviously.
Doctors use the intervention and then they have to save the babies because they've used the intervention.
Every time that they would give me Pitocin, my daughter's heart rate would drop. So after about 13 hours, they're starting to get worried about her. And so they did an emergency C-section.
50% of women who have inductions end up with a cesarean section.
They said they were worried about her, that her heart rate kept dropping. But I was induced, so if we had waited until she was ready to come, it might have been a different story.
Many, many, many more women will end up with a C-section than a vaginal birth by having an induction.
One thing happens after another, and it's like this domino that falls down. And if they don't have the scheduled induction, then they eliminate the 1 in 2 chance they're going to have a cesarean section.
When they told me they could induce me, I was like, sign me up. So,
how far away from the actual expected date were you?
It was her due date.
Oh, due date.
Yeah. We don't use the word due date. We use guess date or guess month because people get all caught up in the date on the calendar. As soon as they find out they're pregnant, they circle that date, like their baby's going to come on that date or by that date, and if it doesn't, something's wrong.
We don't know the long-term effects of Pitocin of the artificial hormone that's used most often to induce labors.
There isn't a woman in this country, in my opinion, who would ever, ever, ever put her baby at risk for convenience. No.
That's why I call it a human experiment.
Obstetrician, a physician trained as a surgeon who specializes in delivering babies.
Obstetricians stroke gynecologists. You are trained in both. And it means that you do obstetrics and you do gynecology. Gynecology is a surgical specialty. It is that branch of surgery that has to do with the female organs.
Cesarean section, a surgical incision of the abdomen and uterus performed during labor to save the mother or baby during an emergency.
My doctor's office, I had heard, already had a reputation. They like to do cesareans because it's easier for them. You hear these things.
The C-section rate in the U.S. in 1975 was a low 7%. The World Health Organization warns not to exceed 15%. Today in the U.S., our C-section rate is an alarming 30%.
A third of all women need a C-section? How could that be? What has changed?
What hospitals and doctors have learned is that it's more efficient to do a cesarean than it is to let the natural process take its course.
I didn't want a C-section, and I made it really clear to my doctors I didn't want a C-section.
They just told me it was my choice, but there's risks involved, and that they just prefer doing C-sections.
It is kind of a no-brainer to say, how come the U.S. has such a high cesarean section rate? Well, it has a high surgical rate because the people you ask to take care of it are surgeons.
They could have tried and had that natural childbirth experience, but they seem to push for the cesarean.
The mechanics of doing it, slice here or slice there, you lift the baby out, sew them up, and there you are, is much more efficient than the vagaries of a natural childbirth where you might have the baby coming out at different kind of angles and creating different kinds of problems.
They told me I was going to have a C-section.
But as a doctor, I have just saved a woman from a dangerous and pathological, chaotic, unknown experience. I've given her a controlled birth in a controlled environment, and I have delivered or produced from her body a healthy baby. What's the problem?
To a man with a hammer, every problem looks like a nail. Well, to a surgeon, every problem looks like a surgical problem.
This last Friday, they had 15 births and 10 of them were C-sections. And it was because Cinco de Mayo was that weekend.
What?
When you get up to Thursday and Friday, they almost double. And then on the weekend, there's hardly any at all.
Because the cesarean is under the doctor's control. I make the cut as the physician. I pull the baby out. I sew up the cut. I know exactly what I'm doing. There's no doubt involved, at least in my mind. And I'm out of there and back at my private office seeing my clients.
My baby was born 9 pounds, 5 ounces, and 20 inches long.
Well, you might think that was easy, and in a technical sense it was easy, but what did you do?
It was kind of mixed emotions because I really enjoyed having the baby there and he was healthy and strong. But at the same time, I missed all the first few moments of his life. They put a big sheet and you can't see, you can't hear.
From the mother's point of view, if she didn't want the cesarean, she's just been robbed of the chance to have the kind of empowering birth that she wanted. She may have been robbed of her chance to bond with the baby, and she may have been robbed of the chance to successfully breastfeed.
And so it was really hard, but it was all worth it. Like the recovery time of 6 weeks is all worth it, having a healthy baby boy and he's just great. 6 weeks to recover.
Cesareans is very difficult to recover from.
C-section recovery is far worse than a regular recovery.
There are many risks of cesarean that are not really discussed, and I think that this is unfortunate, and we may say even is ethically inappropriate.
What if we could go back to where only 7% of all women need a C-section? Because we aren't saving any more babies with all this technology. And you can prove that by America being 28th on the list of infant mortality right now in the world.
Cesarean section saves lives. It also increases the risk that the woman will die, and it increases the risk that the baby will die. It is major abdominal surgery.
Major abdominal surgery that 1 out of 3 women in our country are having. It just doesn't seem safe, does it? In my wedding vows to Mandy, I promised to always protect her. That's one of the main reasons for making this film. Ironically, sometimes that strong desire to protect can actually interfere and cause the opposite to happen.
I'm feeling unprepared for the arrival of our child. And as I'm becoming more and more aware that we're actually going to have a life to take care of, and I've been having dreams of actually holding our baby, and it's becoming more and more real that what's inside of me is going to be outside of me, and we're going to have to continue to take care of it throughout the day. Like, I'm starting to feel more behind because of our traveling, and we still don't have a plan on when we're going to be home, and it's just hard to have everything in our life be so uncertain. I mean, I'm flexible, but starting to stretch the limits of my flexibility when thinking about bringing a new life into our family.
Planning for a baby is hard enough. Imagine if your insurance company told you that they wouldn't cover your medical expenses if you tried to have a vaginal birth after cesarean. This couple had to do something a little extreme.
In the state of Washington, the idea that you would have a normal birth, a vaginal birth, after a C-section is unheard of.
You know, there's really only one doctor around here who's even going to consider the VBAC.
So nobody will do it because everyone's afraid.
We just kind of looked at each other and went, oh my gosh.
I'm practically being forced to go under the knife.
We're kind of held hostage here.
Because I had a C-section beforehand.
There's 2 hospitals that we know of in the state of Washington that actually do
VBACs.
I was so much more excited about it because I thought, okay, I know what to expect this time. I really think I can do it this time.
One is a medical group that basically, from what we've heard, they say they do VBACs, but they almost never do them.
So we went to meet with this doctor.
They let you try.
They do selective. It's very selective who they let try.
Yeah. She was basically like, well, yeah, we do the VBAC, but, you know, it's not usually very successful, and I'll go ahead and give it a try.
We actually talked to them, and they wouldn't take us.
The insurance company will not cover anything.
This is a very complicated issue.
If I have a natural birth, and everything is perfect in my natural birth, it could cost around $15,000.
If we actually went to this particular doctor and tried the VBAC,
if for some reason I really do have to have a C-section, or if something goes wrong, which, you know, not that it's going to, but you want to know,
it could actually end up being $40,000 to $45,000
out of pocket.
And oh, by the way, because I'm not insured, the hospital wants a $20,000 deposit before they'll admit me.
As much as humanly possible, at every step of the way, we're going to remind you how dangerous what you're doing really is.
And I could actually have a C-section. I could do an elective C-section, and it would probably only cost around $20,000.
So we're thinking...
You're starting to make that different choice. Like, well, maybe we should just have a C-section. If we bargain shop, can we get a good price?
The whole possibility of having a natural birth is just like slowly being thrown away.
I called a hospital in Canada and found out that their C-section, the hospital cost, remember $20,000 here, the hospital cost for a C-section in Canada is $2,000.
It's ridiculous.
And then $3,000 a day
for the hospital.
stay.
Most expensive, maybe $8,000.
Part of me still hates to believe that we've come to that place in humanity where everything really is all about the almighty dollar.
It's insane. It's ridiculous. And so as a result, you know, we are pregnant in America and going to Canada to have our baby.
But we'll come back.
Yeah.
We'll come back.
Another weekend where we say goodbye to the United States to go have our doctor experience.
Too bad it's all about the almighty dollar. Bye. You can't have mine.
See you later.
We're lucky, you know. We're resourceful people.
We're empowered. We can make choices.
And we know how to do that. But there are people that don't, you know. I mean, there are women right now in the state who are basically getting cut open because everybody around them is telling them that's their only option and that their baby's going to be hurt, and they're being made to feel like that's their only. I mean, I understand because I felt that way. I mean, I literally shocked to find out, well, how much is this elective C-section? And I was thinking of dates. I was figuring out, well, maybe this day would work or that day would work, because that's what everyone kept telling me I had to do.
So the only affordable answer to having their baby normally was to pack their bags, cross the border, and give birth in Canada. Disturbed by what's happening to pregnant women in America, I contacted ACOG, the American College of Obstetricians and Gynecologists. Their mission statement includes serving as a strong advocate for quality health care for women and maintaining the highest standards of clinical practice. I called to ask what they were doing to help reduce the C-section rate in America to the percentage that the World Health Organization recommends not exceeding. They said they don't speak to filmmakers. So I went to the annual convention that ACOG puts on every year to get more answers. I figured I should be able to find some obstetricians who are willing to speak to me to share the doctor's side of the story and find out what can be done between patients and doctors to change the system, lower the number of C-sections, and make things safer for mothers and babies. Apparently, I wasn't the only one who had an issue to discuss with ACOG. But I came here to talk to doctors. However, there seemed to be more pharmaceutical reps than anyone else, and I couldn't help but to wonder why. Eventually, we did find an obstetrician who would speak to us. He works out of a hospital in Miami, which has a 56% C-section rate. His rate, however, is only 7%, and he is totally disheartened with the system he works in.
I think the trends have changed, you know, globally, actually, certainly nationwide. There's more cesarean sections occurring, and I think less patients taking more of an active role in terms of what they want for their birth experience. A lot of patients now are more comfortable having epidural anesthesia. A lot of them don't seem to be reacting to issues of cesarean section. They pretty much go along with it. They think a lot of people are actually requesting cesarean sections, which I find kind of unusual, requesting surgery when it doesn't need to be done. So here's your choice as a doctor: 20-minute C-section, 20 to 30-minute cesarean section, or staying with somebody up in labor for 16 or 18 hours and possibly getting sued because of a bad outcome.
If I pick up a scalpel and cut open a woman's belly and do a cesarean because I'm afraid of going to court, or I'm afraid that my malpractice premiums are going to be too high, I'm not practicing medicine. I'm practicing fear and greed.
So from a common sense approach, I think doctors are favoring the first, which is, I don't think it's, you know, it's the right thing to do. Right. But it's sort of, you understand where the dynamics are going by here.
When the doctor is in control, he's the one that's reading the electronic fetal monitor.
Well, I think a lot of doctors say, hey, I got a reason to do a cesarean section. I can leave in 20 minutes and get back to my office and not lose a whole night's sleep.
He's the one that is talking to the